Virus corona 2019, COVID-19, SARS-CoV-2. Cause and symptoms. What is coronavirus, COVID-19, causing acute pneumonia in Wuhan? Why is coronavirus spreading quickly into epidemic proportions in a short time? How to prevent, test, diagnose and treat COVID-19 pandemic virus are the questions that need accurate information. What is coronavirus? Outbreak in late December 2019, originating in a seafood market in Hunan, Wuhan, central China. The coronavirus was initially confirmed to be a strange pneumonia, or unknown pneumonia. Reason: just after 100 days. The epidemic of acute respiratory infections caused by coronavirus quickly affected the economic, social, financial markets wobbled. The global economy fell into recession with billions. Unemployment and poverty are unprecedented in history. The name coronavirus is derived from Latin, in which corona means crown or halo. This virus has outer spikes, which interact with receptors on the cell, following a mechanism similar to the key and lock, thereby allowing the virus to penetrate inside. 1. What is COVID-19? The World Health Organization, WHO, states that the official name for acute respiratory infections caused by a new strain of the coronavirus, nCoV, is COVID-19. This new name stands for Coronavirus Disease 2019. According to the keywords coronavirus, disease, and 2019 are the year when this pandemic virus appeared. In February 2020, the International Committee on Taxonomy of Viruses, ICTV, officially named the new strain of the coronavirus SARS-CoV-2. This is a different name from the name COVID-19 that was designated by WHO. The scientists conducted research and isolated a new strain of the virus corona, temporarily called 2019 nCoV by the World Health Organization, WHO, which has the same genetic sequence as the previous SARS-CoV, with levels the equivalent as up to 79.5%. 2. What is the new strain coronavirus? Coronavirus is a virus that causes an infection in the nose, sinuses, or throat. There are 7 types of coronavirus, of which 4 are not dangerous. Ones are 229E, NL63, OC43 and HKU1. The other 2, MERS-CoV and SARS-CoV, are more dangerous and have caused a global pandemic. In addition, there is a new strain of coronavirus, yellow, with the symbol 2019 nCoV or nCoV, also known as the Wuhan virus, which has been raging since the end of 2019 until now. This is the cause of acute pneumonia, causing more than 100 million people to suffer. More than 2 million deaths worldwide. This is a new type of virus, so humans have never had immunity, including cross-immunity before. Coronavirus is a large family of viruses that usually infects animals, but sometimes they can evolve and infect humans. When the virus enters the body, it enters some cells and takes over the cellular apparatus, causing specific inflammatory damage in the respiratory tract, and the virus redirects that apparatus to serve itself, creating new viruses and infecting others. People infected with 2019 nCoV have acute symptoms: cough, fever, shortness of breath, possibly progressing to severe pneumonia, progressive acute respiratory failure and death, especially in the elderly, people with chronic diseases, immunocompromised. The incubation period of 2019 nCoV is 14 days. i.e. from the time of coronavirus infection to the onset of illness is 14 days to have clinical manifestations. This makes the current control measures very difficult to detect. 3. How does coronavirus cause illness? Most coronaviruses spread the same way as other cold viruses. An infected person coughs and sneezes without covering his mouth. causing droplets to be released into the air, spreading the virus to healthy people. Healthy people touch or shake hands with someone who has the coronavirus, which causes the virus to spread from person to person. The healthy person comes into contact with a surface or object that has the virus, and then puts his hand on his or her nose, eyes or mouth. In rare cases, the coronavirus can be spread through contact with feces. On average, one patient infected with coronavirus will spread to 5.5 other people, Chinese scientists said. Because coronavirus has the ability to spread very quickly from person to person, if people are not equipped with knowledge about disease prevention, pandemic is very likely to happen. At high temperatures outside the body, above 20 degrees Celsius, especially above 25 degrees Celsius, sunlight, a well-ventilated environment, coronavirus, 2019 nCoV, will weaken and reduce the ability to spread disease. But if at low temperature, high humidity, cold air, the virus will spread and spread very quickly because this is a favorable condition for them to grow. Origin of the epidemic COVID-19. 1. How is SARS-CoV-2 virus structured? Like other viruses, SARS-CoV-2 virus penetrates deep inside cells, domesticates cells into cloning machines, multiplying virus by many times. If this goal is accomplished, the amount of SARS-CoV-2 virus is large enough to disrupt the immune system, leaving the body unable to fight off and become infected. SARS-CoV-2 virus is spherical, approximately 125 nanometers in diameter, with structure in the order from inside to outside as follows: nucleic acid core. This is the viral genome with the size 26 to 32 kilobase. This is the largest size of any RNA viruses. Nucleic acid core contains single positive RNA fibers, polymer molecular fibers that play a biological role in coding, translation, regulation, and expression of genes, helping the virus to replicate faster. Protein sheath. This shell plays a protective role, surrounded by the genome. Outer shell. The outer shell consists of a lipid and protein double layer. The top layer is a protein thorn that performs the tasks of the antigen, helping the virus to penetrate the cells easily. 2. What is the genome of the coronavirus? The coronavirus genome is the largest of the RNA viruses, consisting of the regions: the 5 UTR region, the open reading frame, the 3 UTR region, and finally the poly-tail, A. There are 4 structural proteins preserved on coverses, which are protein, S, membrane protein, M, envelope protein, E, and nucleocapsid, N, protein. In it, protein S is responsible for binding to the host cell and is the receptor for the virus to enter the cell. The proteins M, E and N are part of the nucleocapsid of the viral particles. According to studies, the coronavirus genome has the following similarities: 50% similarity of the genetic code compared to the strain MERS-CoV, 79.5% similarity of genetic code compared with the virus strain SARS-CoV, 96% similarity of genetic code with coronavirus strains detected in bats, especially horseshoe bats. 99% similarity of genetic code compared to coronavirus strains found in pangolin. When analyzing coronavirus Scientists found that coronavirus of the same species as the virus causing SARS in 2003 with similarity up to 94.6% of amino acid chains. There is an essential gene in the coronavirus genome. RDRP, RNA polymerase-dependent RNA, which is highly conservative, and is used for detection of coronavirus. 3. When was coronavirus detected? Coronavirus is found in both animals and humans. Some coronavirus strains that can cause the common or more serious cold or Middle Eastern respiratory syndrome, MERS, or severe acute respiratory syndrome, SARS. Meanwhile, the new coronavirus is a new strain of the coronavirus that has never been isolated in humans before. This new virus, called 2019 nCoV, was never discovered before an outbreak was reported in Wuhan City, Hubei Province, China in December 2019. The epidemic of acute respiratory infections caused by a new strain of coronavirus has lasted until now in over 215 countries, causing tens of millions of people to get infected. And millions of people dying around the world without signs of cooling. Incubation period of coronavirus. A person infected with coronavirus may experience first symptoms after an incubation period of 2 to 14 days, for an average of 5 days. During the incubation period, the virus can still be contagious. Coronavirus symptoms. Day by day. Coronavirus strain 2019 nCoV is particularly dangerous for people with weakened immune systems, the elderly, children. People with weak immune systems or chronic underlying medical conditions such as heart disease, chronic lung disease, and impaired health. Immunodeficiency, obesity, diabetes. These subjects are highly infectious and difficult to treat due to their fast-changing, life-threatening disease. In particular, the coronavirus is extremely dangerous for pregnant women. When pregnant women get sick, it will have particularly serious consequences. The severity of the pathology for pregnant women is similar to that of 2014's MERS epidemic. Like corona MERS-CoV, SARS-CoV, 2019 nCoV strains are the cause of a wide range of acute respiratory illnesses with dangerous symptoms including high fever, headache, cough, difficulty breathing, and often progressive develop into pneumonia. In severe cases, the patient also has impaired internal organs. If not detected and treated in time, it can lead to death. The incubation period is 2 to 10 days. Symptoms of coronavirus through each day. Depending on the status and resistance, corona infection symptoms in each individual day are different, but these symptoms manifest clearly from 2 to 14 days. Therefore, as soon as there are suspicious signs, the patient should immediately go to the nearest medical facility for timely diagnosis. Days 1 to 3. Symptoms are similar to common colds. Mild sore throat, no fever, no fatigue. Eat, drink, and function normally. 4th. The throat began to hurt slightly, the person lethargic. Start to hoarse. A slight increase in body temperature. Mild headache, mild diarrhea. Began anorexia. Day 5. Sore throat, more hoarseness. A slight increase in body temperature, fatigue, aching joints. 6th. Start with a mild fever. Cough with phlegm or dry cough. Sore throat worsens, pain when swallowing, eating or talking. Body fatigue, nausea. Diarrhea, possibly vomiting. Back or finger pain. 7th. Fever below 38.0. Cough more. Talk more. Body aches and pains. Shortness of breath. More diarrhea and vomiting. Day 8. The fever is around 38.0. Shortness of breath, wheezing, heavy chest. Cough constantly, talk a lot, mute. Arthralgia, headache, back pain. 9th. Conditions such as fever, cough, shortness of breath, heaviness in the chest become worse. 2. Does COVID have a runny nose? Coronavirus is often confused with the manifestations of the common flu. It should be noted, people with the common flu only develop symptoms of sneezing, runny nose, unlike COVID-19. Patients will have symptoms such as cough, dry cough, persistent cough, fever, but no snivel. 3. What is the earliest manifestation of coronavirus? According to a warning from the U.S. Centers for Disease Control and Prevention, US CDC, when you have COVID-19, one or all of the symptoms can appear anytime within 2 to 14 days after exposure to a new strain of coronavirus. Accordingly, the earliest manifestations to detect the disease are fever. Fever is the first sign of corona. Most children and adults will be identified as a fever when the temperature goes above 38 degrees Celsius. Experts recommend that patients should not rely on their morning temperature because viral fever often causes their body temperature to rise in the late afternoon and early evening. Dry cough. Cough is an early and most common COVID-19 symptom. A cough caused by COVID-19 cannot be completely treated with conventional cough medicine. Fatigue. Fatigue, exhaustion. Body aches are an early manifestation of COVID-19. Research by WHO shows that about 40% of the nearly 6,000 infected people experience a period of fatigue. This state persisted even a few weeks after COVID-19 ended. 4. How much fever is COVID-19? After the incubation period, between 2 and 14 days. Symptoms of COVID-19 infection began to appear such as a dry cough and mild fever. Fever suspected COVID-19 is between 38.1 degrees Celsius to 39 degrees Celsius or 100.5 degrees Fahrenheit to 102.1 degrees Fahrenheit. Often accompanied by a decrease in taste and olfactory function. Patients will be treated and isolated at home if symptoms are mild or moderate and resolve on their own within 1 week. About 10% of patients still have symptoms of fever, fatigue, cough, diarrhea, in the 2nd week. If the symptoms last longer, more severe symptoms appear, requiring hospitalization. Intensive care and invasive mechanical ventilation. COVID-19 has an unpredictable course, especially in elderly patients with comorbid background disease. Clinical manifestations range from complete asymptomatic to severe symptoms and death. 5. Are the symptoms of the COVID-19 virus stuffy? According to a report by the World Health Organization, WHO, about 5% of patients with coronavirus have symptoms of stuffy nose. This is not the most common sign of illness. But it is a symptom that is easily confused with colds and flu. In fact, many of the signs of COVID-19 resemble the flu, such as headache, body aches, fatigue. Other symptoms may resemble a cold or an allergy, such as sore throat, cough, fever, and stuffy nose. 6. Are symptoms of COVID-19 cough expectorant? The report released by the World Health Organization, WHO, showed that, out of 55,924 people with COVID-19 followed up, more than 33% of patients showed coughing up sputum. Thick mucus produced from the lungs. COVID-19's cough is not an itchy throat that causes the patient to clear his throat, nor is it just irritation. But this cough comes from the thymus region and the bronchial tubes are uncomfortable. How long does the COVID symptom appear? A person infected with coronavirus may develop symptoms after an incubation period lasting 2 to 14 days, for an average of 5 days. During the incubation period, the virus can still infect others. Therefore, it is necessary to take measures to prevent epidemics under the guidance of the Ministry of Health to limit the risk of transmission. 8. Why do you have COVID-19 but have no symptoms? An asymptomatic person infected with coronavirus is a carrier of COVID-19 in the body who is still healthy or has been infected with the pathogen but has no signs or any unusual symptoms. The reason is that the body has a strong resistance that inhibits the growth, prevents the virus from growing and multiplies. Or the number of microorganisms entering the body is not large enough to cause disease, so there are no symptoms of the disease. In this case, the patient has not shown signs of illness. But if for some reason the resistance decreases, the body will quickly be attacked by the virus and cause disease. The healthy form of asymptomatic pathogen is very dangerous because they can expel the pathogen to the outside environment, causing the spread to others, and the risk of outbreaks into epidemics. Causes of coronavirus infection. SARS-CoV-2 is the cause of acute respiratory infections that kill millions of people around the world. The World Health Organization and experts around the globe are working to determine the origin of SARS-CoV-2. It is widely believed that SARS-CoV-2 is a beta coronavirus, belonging to the family of the MERS-CoV syndrome virus, and the SARS syndrome, all of which originate from a bat host. Subjects susceptible to the COVID epidemic virus-19. The U.S. Centers for Disease Control and Prevention, CDC, has put together a list of people most at risk of getting coronavirus. This is a group of extremely sensitive and fatal subjects caused by coronavirus, including children, adults, especially young children, the elderly, people with a history of illness, people with immunodeficiency or other diseases. Background: heart disease, chronic lung disease, immunodeficiency, obesity, diabetes. Complications caused by the COVID-19 virus. The COVID-19 pandemic caused by the SARS-CoV-2 virus mainly causes severe acute respiratory syndrome. Despite this, COVID-19 has been reported with many common complications such as headache, dizziness, altered consciousness, olfactory disturbances, taste disturbances, seizures and stroke. How to diagnose and test COVID-19 currently. To diagnose coronavirus, patients need to be tested to find the characteristic genetic sequence of coronavirus in the smear of the nose, throat area. Usually, laboratories take 4 to 6 hours of testing to find the specific genetic sequence of COVID-19. COVID treatment-19. Up to now, there is no specific drug in the world to treat coronavirus. All current drugs are symptomatic drugs. Recommendation for the use of the drug in the treatment of COVID-19 must comply with the instructions for diagnosis and treatment of the doctor. People do not arbitrarily use drugs. Avoid poisoning or unwanted side effects. How to prevent coronavirus when there are signs of fever, cough, shortness of breath. People should immediately contact the medical facility for advice, support, and guidance to ensure safety for medical examination. Social isolation and segregation. Social distancing is a measure aimed at preventing or reducing the spread of the SARS-CoV-2 virus. The goal of social isolation is to reduce the likelihood of contact between infected and uninfected people, reducing the risk of transmission, infection and, ultimately, death. Vaccine. COVID-19. The whole world is sprinting to produce COVID-19 vaccine with the hope of ending the global COVID-19 pandemic. To date, More than 100 vaccines from more than 40 countries have participated in the race to produce COVID-19 vaccines. As of October 2020, there are 321 vaccine candidates being developed worldwide, of which 56 candidates are in the clinical research phase. COVID-19 room AstraZeneca vaccine, UK, is up to 90% effective with 2 injections. Nutrition for COVID-infected people. 19 Once a person has been infected with coronavirus, the focus should be on enhancing nutritional care, improving the condition, alleviating symptoms, shortening the duration of treatment, and improving treatment efficiency. It is necessary to soon plan to raise people infected with coronavirus according to specific nutritional status and clinical conditions.